Now the third point to be known as a Tian Fu. Tian means is the heaven Fu. Right. The window of the heaven point. And also the most important point, where exactly this point is located. Now, where this is the axillary crease. This is the axillary crease. From the axillary crease, 3 chun below. 3 chun below. When you understand about this is the medial side. But medial side cannot be advisable. On the lateral side you come. This is the medial side, 3 chun below. But this point is different. This point is different. Pericardium point and heart point. But we are not taking that now. So you just come down 3 chun and then come on the lateral border of the biceps muscles. Biceps brachii muscles, lateral side. So not on the same side. When you recognize from here 3 chun, then you this to be considered as a Tian Fu. Tian Fu. So I just apply the needle where exactly is located. In the zoom you can recognize where the point is located. So anyone having the doubt to identify that point, you also have a look where exactly the point is located. So from here is 3 chun, come down, then you come here on the other side. On the other side you just come down. This is as a LU5. From you do the biceps muscles. You do the biceps muscles like this. Yeah, you can show that your muscles. 6 packs or 3 packs, how many packs you have, you just show me. So now this is the biceps muscle. Inside, this is the outside. Yes, you just leave it now. Yes. So this point to be known as a LU3 point, which is the most important point to treat for the Tian Fu. That means is the majorly you understand anywhere is swelling, anywhere on the body is having the distension, and also kind of the lump, cyst, thyroid gland enlargement, or maybe the anywhere in the swelling is there. So that time you can use the 3 points, you keep it in the mind. One point to be known as a LU3. The second is Li14P now, Li14 and Sanjo 13. Sanjo 13, that means SJ13, and then LU3 and then Li14. Along with that, you just add up the one more point is stomach 40, Fenglung. So these 4 points are very good point to treat for the anywhere on the swelling in the body. Swelling means is the lump, cyst, fibroid, something like that. Especially the thyrotoxicosis, the goiter related problem can be treatable successfully by activating the third point that's called as a Tian Fu. So therefore you recognize whenever situation is there, when the thyroid gland got enlargement, so that time you can use the point is LU3 point is good. So hopefully I'll repeat once again. For the any kind of the swelling and also the mass level of the accumulation or the retention of the lipoma or the thyroid gland enlargement or the goiter or the thyrotoxicosis, something like that. So you just use the 4 points. One is the LU3 point and large intestine 14 point, large intestine 14 point, then SI, then Sanjo 13 point. So again you just add up one more point, stomach 40. So these points are always is good. When you do the moxibustion continuously to this point, definitely the dissolvent to be taken place. Use the moxa on the thyroid place and use the moxa on these points, but definitely have the positive impact. Slowly the dissolving substances can be taken place, because the stomach 40 is the moxa can be shown on the neck region as well. So you just show on this region for 5 to 10 minutes Maximum 20 minutes can be shown, that having the great impact to treat for the. Yes. Smoke inhalation. Yeah, some people like the smoke, and somebody they don't want to smoke, they can use the smokeless moxibustion as well.
So moxa can be done on Sinjayu 13 too?
Yes, 13 and other points as well. Yes, good, we can use it. Auxiliary lymph nodes also we can use it. Now the fourth point is Siapai. Siapai, one shown below to the lung 3 on the radial side of the biceps brachii muscles, but this is as a oxygen point. Which is the oxygen point over here? So one shown just distal to this point, you just apply yourself. Then apply the needle here, one shown below. Yes. Good. So now we are applying to the oxygen point, that indicating whenever the lungs is deficiency, whenever the lungs is not accepting, the excessive toxins are accumulated, shortness of breath, breathlessness or wheezing, something like that. But definitely we can use the point to be known as a CRPOI, that is the LU4 point, to treat for all the pulmonary lungs related disorders for emergency conditions. Along with that, you wanted to add up the one more point, that point to be known as a Kung Sui, that is LU6 point. LU6 and then LU4, both the points are oxygen point on our body system. Whenever you try to find out the spirometer, you can use that what we call as a thumb. We see the SpO2. What is the normal SpO2? Yeah, greater than 90 to be normal. If there is a less than 90, that means the asthmatic patient will get the lesser SpO2. That time need to be activated, you can use it. When there is a spirometer also is there. Spirometer means we have to blow. We blow, then the balls goes to the upward direction, then it come down. All the 3 balls are there. If you can blow it that properly, so then your respiration is good. Your respiration is very poor, then you cannot blow to that will not test to the upper part of the bottom on the spirometry. I think we do have in our center. Sometimes we will see. Now hopefully these are the few points which we were completed now. Point to treat for all the lungs related disorders. So I wanted to use as LU5. So when the leg related problem you do have, that time use the K7 point. When the patient having the hand related problem, rather than K7, better you can use the LU5. That is good to treat for the lungs and then shoulder as well. Isn't it? So now when we need to apply this, what time need to be applied? I think organ clock theory you need to register in your mind. Yes, all of you please go through in our book. We have already mentioned that each and every organ having the 2 hours peak activity timings. Every organ sometimes more active, sometimes is the less active. Tell me what is the right now time? 12? Very good. 12:30. Yes, 12:30. That means 11 to 1 is the hard time. 11 to 1 is the hard time. 11 o'clock having the peak time of the lungs, peak time of the heart, but at the same time at 1 o'clock, it declines the heart energy. It decreases the heart energy. When you wanted to treat for the heart, 2 hours I told you. The first 1 hour will be the activation. The second hour to be known as a sedation. This formula need to be registered forever. All the organs, yes. Sedation. Activation. 11 o'clock to 12 o'clock is the activation to the heart, and 12 o'clock to 1 o'clock is the depletion of the heart or the decrease the energy of the heart. Now let me talk about the lungs. The lungs maximum energy?
3 m to 5 m.
Yes. 3 to 4 activation, 4 to 5 sedation.
Sedation.
Then morning 4 o'clock, is it possible to treat to somebody? Where are you? I know that. Right. Where I am, I know that. We are getting the mushroom dreams in the night. Right.
Yes,
So therefore we don't get the time. Then what is the alternate for that to treat? Then I will give you some extraordinary information, but this it will take, maybe you come to know the answer. If you don't recognize or you don't know to understand or difficult to understand, don't worry. But maybe later period you will come to know. But now I will tell you, but morning is, I told you, 3 to 5 a.m. But same opposite timings are to be known as a, yes, diametrically opposite timings, that to be known as a the lungs chi. You wanted to treat the lungs energy, treat by 4 p.m. 3:30 p.m. or the 4:30 p.m. Then don't get confusion that maybe that's required more time. I tell you, please, you just activate that point. Which point? LU5 is equal to K7. Right, K7. You can do it in the opposite time. You can use it to treat for the lungs 4 p.m. or you can use it. Now I will come to that. This is LU5 is equivalent to the K7. What is the kidney organ clock timings? 5 to 7.
5 to 7 p.m.
Yes, 6 o'clock is the peak time. 6 o'clock, what is required the energy? Kidney required the energy. Not in the evening. When it is required? Morning energy is required. Remember, that is the 2 hours having the peak time of the lungs. The opposite time having very low energy on that particular organ. See, so many theories is there. I told you 1 hour theory also. Now I am telling you 2 hour theory, right? 2 hour theory, you keep it in the mind. 3 to 5 having more energy. Peak time is 4 o'clock, right? So in that way, opposite time also 4 o'clock having the low energy in the lung in the evening. So that time we give the energy to the lungs. In that way, we recognize LU5 is equivalent to the which point? K7 point. So K7 is the mother point or the sun point? K7 is the mother point. LU5 is the sun point. LU5, sun point. It decreases the energy. Once it decreases the energy, it goes somewhere. Where it goes? Yes, it goes to the kidney. Then kidney 7 is the mother point, which is strengthening and nourishing to the kidneys. One is the sun point, the opposite is the mother point. In that way, you keep it in the mind. So now LU5 is equal to K7. When LU5, when we need to apply the needle. LU5, when we wanted to drain out the energy. Mother point, that you will come to know later. So now LU5, you just applied, but you take the energy when the morning energy is more in the lungs. By what time you wanted to extract? 4 a.m. you wanted to extract because lungs energy get excessiveness. Maybe it may not be possible that time. The another time to be known as a kidney time, K7. What are the organ clock timings of the kidney? 5 to 7 p.m. or a.m.? PM already having the more energy. We may not be required to give the energy to the kidneys at 6 p.m. already existing. But 6 a.m. empty energy. Then what time we should provide the energy? Morning 6 a.m. Give the energy, that K7 point you just apply to strengthen the renal system. Morning 6 a.m. There are the 2 timings I told you as per the organ clock theory. Please, organ clock theory, I didn't take the proper way. But people, whenever I will talk to you, I'll tell you regarding this organ clock timings as well. You people need to do that and make it the assignment of the tune finger measurement and also related to the organ clock theory for the next week. Right. Do the assignment and then come and show me.
When the person comes to the clinic, he may come at any random time.
Yes, that time you just apply any time, that LU7, LU5 or K7, apply at any point of the time. When that timings may not be suitable, at any time you can apply that point, because the time bound sensitivity, that to be known as per the organ clock theory, when there is a proper way to penetrate and activate and treat to the patient based on the principle of organ clock theory. That's very important. Hopefully you understand. Now you recognize in the clinical sign and symptoms, I would like to say LU5 is located on the cubital crease, on the bicep tendon region, on the elbow this point is located. As I told you, is the sun point, sedative point. Then what are the indications? Remember, this is a sun point. Sun point is indicating when we wanted to use the sun point. When we wanted to use the sun point, because the excessive energy is there in the pulmonary system. When the excess energy is there in the lungs, that time you drain out. When the lungs having the deficiency, you need not to drain out. Maybe possible, that also, but that is the different theory. I'll talk to you later. But whenever the patient having the excessive energy in the pulmonary system, that means the retention, foreign substances, foreign particles, the dust, pollen, pollution, smoke, and all the phlegm accumulation, retention is there, because the spleen is the production of the phlegm. The lungs are the container of the phlegm. So therefore, spleen it produces more, and then retention is there in the lungs. So that condition, we need to drain out that which is unwanted, cleanse out that. So that time we can use this point. I'll give the analogy. For example, there is a water tank is there. In that water tank, when you have gone to the vacation for the 3 months to the USA, once you come back, that storage of the tank was there, and the water was immersion, lot of water inside, and also the dust particle, many foreign substances are there. What you will going to do? Drain out that first. Open the tap, and then again you just pour it, then proper nice water to get the purification of the entire water. In that way you just cleanse the lungs. Whatever there is accumulation is there, small accumulation, small retention, small substances of the mucus, the foreign substances, or maybe shortness of breath, or the breathing difficulties, or maybe the chest congestion is there, nasal congestion is there, the skin allergy conditions, when the dermatitis, psoriasis conditions, definitely you can use this point and then withdraw the some amount of the blood through this particular point. Sir, as I told you, the drain out, how you are going to drain out? You just use the drain out is the sun point, you just applied. What I need to be done? I need to withdraw the needle rapidly. Sun point, once I applied, I don't close the hole. I just withdraw the needle quickly. Now I just withdrawn. Rapidly withdraw the needle. Don't close the hole this. Let it be bleed. Lancet. We wanted to bleed this point to drain out. So where exactly the location? I find out some of the blue color veins over in this region. Show me that hand as well.
Sir, could you please roll down the camera?
Yes. You hold it like this. First you try to apply the spirit over on that region. I just applied the spirit, but I used the lancet. This is the 3-edged lancet where the blood lancet, and then I just prick with this. Right, where exactly the engorged veins or the blue color veins are there. You just take the deep breath. Yes, yeah.
Sir, you are bleeding on both lateral and medial.
Yes, exactly. Now the engorged veins, where exactly I can see very less visible veins for him. And then what I do after doing this, we just apply the cup over this region. Very small 5 size cup you just apply, and then drain out the few amount of the blood. So once this will come out, the toxins which is accumulated in the pulmonary system, that also comes out. When the derma level skin related problem is more retention of the unwanted chi, so that also will come out through this blood. So the great point to bleed on the lung meridian, that to be known as a LU5. The second point to be known as a LU7. I will come to that point. So when we
Are you sitting on the veins? Did you prick on the veins?
yes, engorged veins. So not the artery, but where you all of you try to see, that is the blue color veins. So blue color veins, you just use it, the water, you just wipe it the water, or you just use it as a water, or you just clean it with the spirit, you come to know the blue color veins. So there you just bleed it few drops, that definitely have the positive change to treat for the skin related disorders.